Well, it has been a 10-year journey so far. When Organisation with a Memory was published in the UK and the Tuera's Human Report by the Institute of Medicine in the States. And at that point, I think people really didn't have a good understanding of the scale of the problem of unsafe care. And those two reports set it out very starkly and shockingly, really. The burden of harm in healthcare systems is very, very high. And that just wasn't recognized. So there's a greater recognition of the scale of the problem, but also the nature of the problem. When things went wrong in healthcare in the past, I think people used to regard them as a parochial one-off event. And although you could learn something from it, you learned for your own hospital. But with the recognition of the parallels with other industries like the airline industry, systems thinking came in. So now people recognize that if the same thing happens to different people in different places at different times, there's a common cause, and it's understanding what that common cause is, how the system provokes the error and the harm, that people now do understand. There's still a long way to go, but I think we've come quite a lot of miles so far in the 10-year journey. Well, I think the World Health Organization campaigns, the Clean Care is Safer Care, focusing particularly on hand hygiene, and then the Safe Surgery Saves Lives campaign with the introduction of the checklist. I think both of those have reached many, many parts of the world now, and those good practices are in place. So I think that's helped to change the culture. People realize now that there are practical things that can be done, but they require not just introducing particular measures or interventions, but they also involve cultural change, getting the whole of an organization like a hospital to see the importance of safety, to understand all the ways in which things can go wrong, and then to try to reduce risk and improve the safety of care for patients. I think that it's a very interesting question to know whether the big tragedies and crises in standards of care and standards of safety have had a reverberation through the system. It's undoubtedly the case that a lot of attention's been paid to them, a lot of care is taken in responding to the inquiries and the expert reports like Francis and Berwick and Bristol, and also trying to put in place measures to make sure they don't happen again. But having seen many such situations around the world in my World Health Organization role, I think it's very interesting to note that sometimes, even when something very bad happens in a hospital or in a healthcare system, it doesn't create the so-called burning platform where people realize that from this moment forward, everything's got to be different. And it's very difficult sometimes to say why that happens in some places, as it did in the Dana-Farber Cancer Institute in Boston after the death of Betsy Lehman, the health reporter of the Boston Globe, due to a medical error, a medication error. It was a burning platform. The whole institution changed. It was transformed. It became totally patient-centered. And then you can look at equally serious errors happening in other hospitals around the world, including in the UK. And yes, there is a response, but it's far from the burning platform. So I think that's something we need to understand much better.